Recent viral videos have exposed the harsh reality of systemic racism in U.S. maternity care, highlighting critical failures in how Black women are treated during childbirth. One such incident involved Mercedes Wells in Indiana, who was dismissed by hospital staff despite severe labor pains, leading her to give birth on the side of a highway. A similar case in Texas saw another Black woman denied care, also resulting in a highway delivery, underscoring a disturbing pattern of neglect. These events are rooted in a painful history, tracing back to figures like Dr. J. Marion Sims, the father of gynecology, who performed experimental surgeries on enslaved Black women without anesthesia. This legacy of exploitation, using women like Anarcha, Lucy, and Betsy as subjects, laid a foundation for ongoing disparities and a devaluation of Black women's pain. Today, implicit bias, unconscious prejudices, causes healthcare providers to dismiss Black women's pain and concerns, contributing to systemic racism in medical practices. The data reveals a stark reality. Black women face a maternal mortality rate of 50.3 deaths per 100,000 live births, significantly higher than the 14.5 for white women. Furthermore, 40% of Black mothers report mistreatment during childbirth, a rate far exceeding that of other groups. Disparities extend to prenatal care, with 10% of Black women receiving inadequate care compared to just 4% of white women. Systemic barriers also include the historical decimation of Black midwifery, which once provided culturally competent care to a vast majority of Black births in the South. Jim Crow-era regulations and acts like the 1921 Shepard-Towner Act marginalize these vital caregivers, drastically reducing their numbers by the 1970s. Modern obstacles persist, including transportation issues, a deep-seated distrust stemming from past abuses, and biased medical protocols. The Mercedes Wells case gained national attention in November 2023, prompting Indiana lawmakers to introduce the Wells Act in 2024. This act mandates implicit bias training for maternity staff and establishes protocols for pain assessment to prevent future dismissals and ensure equitable care. These efforts are crucial steps towards dismantling systemic racism and ensuring that all women receive the respectful and competent maternity care they deserve. View the full in-depth story at africanelements.org to learn more and support the fight for health equity.